to get as many fingers as I can in there. Now I'm in my cuff. And then I'm just gonna pull up over here. Even if it's not on good, I can kind of fix it like this. So that's not great, but it happens all the time just because of the way you're putting your gloves on. So from here, I don't want to come up here, right, and be bouncing around on my table. I just want to walk up, grab my gown, and grab my gloves that I'm going to use. You can put this wherever. The reason I always do left corner is because our rooms, the way they were set up, you were always coming in from this direction, for the most part. Unless we were doing something on the left side, you might have to put everything on the left side, but that doesn't happen a lot. So you can put this wherever you want. That's just kind of like an ergonomic thing, I guess. And then, so how far am I wanting to stick? Can I do this? I don't want to do that, right? I want to try to do an inch for sure. Or for checkoffs, we're doing an inch for sure. Inch is usually about like the size of your knuckle, like from here to here. That's about an inch for the most part. So, I mean, you're pretty good. You can move this, our blue part, so say I'm kind of over here. I probably would try to fix that a little bit better, straighten it up a little bit. But I just want to do it from here. I don't want to grab here. I don't want to do anything else from there. So I probably would have done that in the first place. Just trying to straighten it up a little bit better. So I'm here. Now what else am I going to do right now on this table?
Nothing.
That's it. The only thing we're going to touch is our gloves and our gown. Now we can go ahead and get the other gown. We're not going to need it because we're not going to have somebody who's going to scrub in. If there's time, I might throw another pair of gloves on and make you gown me or something, just so you get used to doing that, but it won't necessarily be part of your check. So we're just going to stack them both up here. So we would do this actually, because what we're going to come in, we're going to gown and glove. That would be out of the way. The doctor would come in, and technically we'd have their gloves under here. Gown, helping glove, go from there. So we're going to do this, and that's it. So we're done with this part. So here, if you put your lead on before this part, that's fine. It's not that big a deal. You're just going to be wearing it for a little bit longer, and you might get sweatier. So I'm going to have my lead here. So again, gather your lead before you do any of this stuff, because I don't want to now go over here and try to gather my lead up when my table is already open. I mean, all I'm doing is putting my lead on now, right? So pick the one that fits you good or whatever, and go from there. This was actually my lead, so. Oh, okay, so I'm good here. I'm not gonna wear my thyroid collar because it's a little too hot, but you do want to wear these in real life because your thyroid is extremely sensitive to x-rays. So you need to make sure that you have one of these. It gets a little claustrophobic sometimes, but they have covers to kind of help it not rub on you. But if you can get one of these, I would wear one. Your thyroid's kind of down in here. It's any x-rays that get to it can just cause a lot more problems. Your thyroid's very sensitive. So we're here, so I'm gonna go ahead and, you don't necessarily have to do anything with these, but that's out of my way. So now what? I think we're ready to scrub. So I'm not gonna hand wash. We're just gonna go ahead and call it Avogard. There might be different names, but we're just gonna say it's Avogard because that's what we've used, and that way we can distinguish between hand sanitizer and soap and water or whatever. So I'm gonna make sure I'm kind of set right here, right? Because after this, I can't really touch a whole lot, okay? So I'm gonna come over here. I'm gonna go ahead and go. Hopefully this is gonna work. All right, we're gonna pretend, because this stuff dries up really fast. They're like Avogard, right? So this is where really what you wanna do is get like a pool there in your hand, pool here. Either way, we're gonna scrub, do all the planes. We're gonna think about just rubbing it in all over, right? And we're gonna go ahead and go 2 inches above our elbows for this part. Just official check off, that's the way we're gonna do it. So now I'm pretty much scrubbed in. I mean, I'm not scrubbed in, I'm scrubbed, quote unquote scrubbed. So now I can come over to my table. So again, it kind of depends on where you're coming from, but normally doors over here, I'm gonna come in. That's why first thing I can touch is where I usually put my gowning gloves. But if you all have it over here, because of the way we're doing our checkoffs and the rooms are set up, it doesn't matter. So I'm gonna come in, and again, we wanna make sure that this folded side is out this way. Because that way when I come in, I know that that's where my hand goes. I know that's where my arm's gonna go. Just watching all the folds for towels and everything. So I'm gonna come here. Here we go. And then so I kind of have to watch this part. You can kind of come around this way. See how that's sticking out? You just want to be careful because technically we're only sterile from here to here, right? So I'm going to flip my gloves around. I like to do it like this. I should have worn deodorant today. So I'm going to close the glove. All right, so you can kind of do it. If they're on, I wouldn't worry about it. You can always fix it later. I like to flip my gloves upside down. It's just the way I like to do it. Here, and then I can kind of pull my gown and stuff. If you pull too hard, it will rip. So just kind of, just tug on it. You don't have to like try to rip the whole arm on. I personally like for my cuffs to kind of be over my hands like that a little bit. It just feels better. I know that my gown's not going to pop out like in the middle of the case. It just feels good to have it like that, like kind of over your hands. If you can get to where that works like that, great. So this again, we'll have our big trash can. I don't need this anymore. And then I'm gonna spin, right? So you would be me, right? So you always want to just split them like this. So think about this thing's gonna be in your right hand, okay? So then I'm gonna hand off. We have a split part. So she doesn't want to touch anything above the blue. I want to keep over here. So I'm gonna hand off. She's just gonna stand still. I'm gonna come around this way, and you're gonna hold tight. And I tie myself up from there, okay? So we're scrubbed in. That's half the battle. As far as like what we're concerned with, like starting off new, right? Being a brand new person. Okay, so again, we can kind of move this around. I don't really need this gown. I would leave it on here, get it out of your way, do whatever you need to do, put it in the middle, however you want to do it. I'm gonna gather these things up. So this is all kind of personal preference. The one thing I would say is when it comes to the folds, I would always make it to where I can see my folds, or I can grab them like this, if that makes sense. I don't want to do this because if I get in a hurry and I grab this, it may come undone on me, and I don't want to be messing with a stupid towel when I'm in a hurry. So I'm going to go here, and then I'm just going to start splitting my stuff up. So I'm going to stack this up. We get my gown, my drape. So again, it's the fold here, right? I'm going to put this something like that. You don't have to do it exactly like this. It's just, as long as you keep everything neat, organized, nothing's hanging over, you're good. The reason I want to put my drape this way is that my patient's back here, right? So if my patient's back here, I'm doing my stuff. When I get ready to drape, which we are going to do the drape part, all I have to do is grab this drape from this point, turn around, and it's in the right spot. I don't have to think about flip-flopping it around. This is not marked left and right. You just know that this is the left side or the right side because we use it all the time. And when that folds there, that's going to be the right side, right? So here, we're here. So at this point, it's just going to take me a couple of seconds to get this stuff ready to go. So at this point, I could go ahead and ask, hey, can I have some fluids? So if somebody wants to pour my fluids, great. If we want to pretend, that's fine too. But either, because I know you're writing and messing with your phones, and that's fine. This drape, you don't need. If you want to get it out of your way, totally fine with me. Real life, if you have a place where you can cover the table up and use it later, that's what you're going to use it for. But for now, if you want it out of your way, just get rid of it. But don't do something like this, right? I just contaminated my hand, and I've got to not necessarily start over, but I'm going to have to re-glove for sure. So if you're going to do anything, stay away from it. If it hits the floor, who cares? Because I'm not using it right now. So I'm going to just, basically right now, I'm trying to organize, get everything straight, keep everything, get everything where I need it. I'm probably just going to dump this out. You can split this up however you want. I'm just watching my inch here. So you can do this and this. It depends on how you want to do it. There's no right or wrong way to do this. When you go someplace and they're like, okay, throw me a table, let me see if you know how to throw a table. They might be like, okay, now let's put this here. That's just one of those when in Rome things. You do it however they tell you to do it, and that's fine. It's going to be, everywhere you go, it's going to be different. So we're here and here. These clips, I don't use these for anything. So I might even put these kind of out of my way. Like I'm not going to use those. So push them out of my way. What's this one going to be for? Lidocaine. This one we use for lidocaine. Now, whenever I put these somewhere, I don't want to do this necessarily though, because what's going to happen if somebody comes to pour my fluids? They're going to have to reach, for us considering it, they're going to have to reach all the way over here to do it. So I'm getting them as close to the edge as I can without going over my 1-inch board. So I'm going to do this, and then that way, somebody's back here, they can come up and they can pour my fluids and not have to reach over my table, basically. So I'm going to do something like this. We've got our 2 drapes. So the one that's got 2 numbers on it, what's that for?
Shield.
The one that has 2 numbers is for the shield, because it's like a rectangle. It's 36 by 28. It's like 36, should be 36 up and down, if you vertical, however you want to call it. 28 wide, basically. So when we open that up, it's like a rectangle that goes over our lead shield, which is basically like a rectangle. The one that goes over our II is just like a huge shower cap, is all it is. It's 25 inches, 23, you'll see different ones, but it's just got one number. It's just talking about pretty much how deep or wide it is. I'm not really sure which one. But if it's got 2 numbers, it's for the shield. We're not going to use these, so you can kind of get these out of your way if you want to. Maybe put them somewhere where they're not going to be in your way. But we'll still maintain our 1-inch order. Then I'm going to grab I like to grab all my syringes and put them in one spot. Or at least, like, I'm going to put my 2 3cc syringes together. I'm going to put these together. Okay? We're not going to use these right now. We're going to use these mostly for meds, more than likely. If we have to draw blood, we could use it for that. We put a little bit of heparin in them. We would just line them with heparin, kind of pull some heparin in and then squirt it back out. That way when we draw blood, it won't clot on us in between here and get into the lab. But we're not worried about that right now. So I'm going to get those out of my way. I'm going to get my needles kind of organized here. I know I'm going to use a towel to put my needles on. So again, these have a fold in them. They don't always have that. I'm going to put this fold away from me on this one, because if I do it this way, when I go to grab it, sometimes it'll split like this. I don't want that to happen. If I go to grab my sharps, I want to do this and turn around and have them stay all together. So I'm going to go ahead and do this. Put my needles kind of where they're going to go. I'm not really going to put that one on there because I'm going to use it. So now this is already in order, right? My small needle, my baby needle, 25, 21 or 22, depending on where you're at. I think ours is 22. 18 gauge per needle, 7 centimeters. That's 7 centimeters. There's a 9 centimeter for really thick people. Some places might not even have it. They'll just jam this down in there until they hit the artery. Kind of just depends on who you're dealing with. These, as far as I'm concerned, we're not necessarily going to use these on the table, but what would we use these for, like right now? If we were going to, not right now, but throwing our table, starting a case, what would we use these for? Blood dissection. If we make the nick and get down there and it's blunt because we're just like digging around basically. We're going to open up a spot for that sheath to go through. I'm not going to say that we have to do that part because not everybody does that. But if I asked you what those were going to be for, that's what you would use them for. The other thing you could use them for is if we had to sew the sheath in. Technically, they're not the best thing to sew with, but if we're just sewing a sheath to the top of the skin, it's not that big a deal. So we could sew with them also. But I'm going to go and get those out of my way because I'm not going to use them. I want to make sure I keep up with these for sure. My stickers for my meds or for any fluids that I got. So at this point, all we have is what kind of syringes? Luer locks, right? So at this point, like on a real table, when you get somewhere, they're probably going to have slip tip syringes on there. This is again just like the cheapest way to do it. So you all don't have to pay too much for a tray or a table, whatever. So they just come with luer locks. So you need to ask for slip tip syringes. Probably, I would ask for at least 2. Hey, can I have 2 slip tip syringes? I'll open them. I would even ask for the expiration dates on those. I don't think that they're going to have one on them, but it's not going to hurt to ask. You're not going to get penalized for for being an overachiever for expiration dates. It's better to ask than not. So somewhere in here though, right? So I'm like sitting here just kind of waiting, right? So while I was doing all this stuff, I would ask somebody to pour my fluids for me. So you're going to ask me or Julie, can I have some saline? Be specific. Can I have some lidocaine in this cup? I think these are 60. So if you could say, can I have some lidocaine in my 60 cc cup? That's like, you can't get much better than that because you're being extremely specific and you're telling us which one to do it in. These are probably going to all be 60 because Most of the lidocaine bottles are 50 cc's. So if you, and so like this, I'm gonna do just because, don't do that, but if you put 50 cc's in a 50 cc cup, it's gonna be all the way to the top, right? So these are a little bit bigger to keep some fluid from being all the way at the top. Just like your coffee, you know, you don't want a coffee filled all the way to the top, it's gonna splash on you a little bit. So, can I have some lidocaine in my 60 cc cup? As I do that, so I'm over here, I'm gonna come over here and pour my fluids. I'm probably gonna say, okay, how close can I get? How far do I need to stay away? We're gonna say 6 inches for fluids. And then I might even say, okay, well, let's pretend this is my lidocaine cup. I wanna do 6 inches, but I also don't wanna necessarily be like right in the middle, right? So I'm gonna be over here, unsterile, right? I'm gonna be over here and I'm gonna pour. Basically, I'm trying to get like this lip with this lip as even as I can. I don't necessarily want to come all the way over here in the middle. It's just one of those, just to be as sterile as possible, is all it is. So at this point, somewhere in between here, I got some flush, a little bit of flush in here if you want to. We usually just put it in these because we're gonna have what kind of bowls? What are we gonna have? We're gonna have a waste bowl, and then just our saline, right? Or for our flush, whatever. We don't ever want to put our 4x4s. We'll wet our 4x4s and use them to wipe everything down, but we never want to dip them in our saline that might go inside the body, because they're supposed to be lintless, where it's like one string makes this whole thing or something like that, but you never know. What if there was something that caught on this paper? So don't ever dip them in your flush. And I would go ahead in real life, I'd go ahead and take a couple of these off, because that way I can grab them and use them and get rid of those. Again, these are going to be folded to where there's always a fold on anything that's folded, right? So I always want to put that toward me. So now if I have to grab some of these, I can take them, I can split them up, I can do this and put them on my table. The doctor, I can use them to kind of clean up a little bit. That's really all they're for. Or we're going to get some a little bit wet and use them to wipe everything down, or wet ones is what we're going to call them. So I'm going to ask for a lidocaine here. I'm going to ask for an expiration date. Whenever Julie or I walk over here, you're going to say, oh, can I see the expiration date? As long as you do it, they're pretty quick. You know, if you catch yourself later, obviously, you can still do it. That way I know that you're still thinking about it. But try to do it as we're doing it, even though I know you're doing some stuff. So let's say I get my lidocaine. I'm going to start filling my syringes. Don't do this. This is probably the part that takes the longest, because you have to mess with writing everything down and putting stickers on everything. But if you go slow on this part, you won't get bubbles as much, right? So if you try to do this, start doing it real fast, you're going to get more bubbles in there, and that's one of the big things we don't want to do. So when you get to this point, take your time, and you can even, to keep from reaching over like this, kind of pull your cup over here, and you can hold this cup. It's sterile. It's your cup. You can hold it if you don't want to. If you're afraid you're going to knock it over. So we can do this. So again, we're going to prime our syringe. So we're going to put it in. We're pretending there's liquid in here, right? So I'm going to pull back just a little bit. I'm going to push. I'm going to pull back, and then that should be fairly bubble-free for the most part. So again, you have just a little bit of air, or really the easiest way to do is just stick it in there the way it is, so you don't have to mess with it. Aspirate a little bit in, so there's going to be air in it. Push that back out, or back into your bowl, whatever you've got, and then slowly aspirate again, and you should be fairly bubble-free. I'm going to knock it on here, get the bubbles out, go from there. So I did that one. I'm going to do my lidocaine. I'm not going to do this because it's going to take too long, but we want to do our percent and what it is, right? This one has lidocaine on it. So I'm going to put 1%. I think ours is 1%. That's what most of the time it is. So 1%. So I'm going to put this on here, and I'm going to try to keep from covering up my numbers, just because it's just easy. You'll figure out. I mean, you see where the 10 is. In between that's 5. It never has to be exact. It's just you just don't want to cover it. So I'm going to do that. I'm going to do this other one. I'm going to stick my syringe down in here. I'm going to pull back. I'm going to push forward, aspirate, push. I'm going to have this one ready. So as I'm doing it, I'm labeling. So now I've got 2. I would say for what we're doing, you don't necessarily have to do another one, because then you're going to have to write on it. If you want to pretend that you're going to use, whenever you do the sticking part, if you want to do this thing, we have some lidocaine on there, then you want to use some more. Or, I mean, totally legal. If you're doing it however you want to do it, as long as you do the 2, right? We have 2 labeled syringes that have lidocaine. I would say, we'll just say 7, 8, somewhere in there. I mean, you don't want to fill it all the way up, because you can't aspirate. It's the big deal. If you filled it up to 10 even, I know we said the numbers we said was 7, I think. It's just a way because everybody gets worried about that. As long as it's got more than 4, I mean, you can't really do much with that. You can't numb much with that, right? You can do the very top of the skin, but it's all on our table. We're just going to pull it up. In real life, you're probably going to use 10, unless the doctor says something specifically not to do that much. So 7, 8, 9, 10, you're good. We're not going to say, oh, you put 8 instead of 7. That's not how it's going to work. So I'm going to have that up. I'm going to have this up. I'm going to go ahead and put my needle on, crack this thing, do this. So really, what I'm going to put on the table to numb is ready to go. So again, in between this, at some point, you can ask for a sheet. If you do, that tells me that you know you need one, right? I'm going to do, I'm just going to pick a sheet and throw it to you. If you don't ask for it, I'm probably just at some point going to throw you one, but you really, if you need anything else on your table, you basically need to ask for it, if that makes sense, right? Because I'm going to wait to the very last before I do it, and then it would be like I'm having to help you do it, as far as our checkoff goes. So I'm going to ask for a sheet. At the same time, I'm going to have some slip tip syringes, and I'm going to be filling them up, right? So I'm going to fill my slip tip syringe up. I've got heparin, and we're going to do, it kind of depends on where you're at, but we're going to do 5,000 of heparin, right? And so I'm going to write 5K on there. It's good enough, 5K hep. Well, it's already got heparin on it, so we don't have to worry about that. Usually the red ones are heparin. So I'm going to label that thing. And I would go ahead, again, this would be a slip tip syringe. I'm full. Again, I'm going to put the tip of the syringe in. I'm going to pull back, aspirate, I'm going to push forward. It primes it, it gets it kind of cleared out, and then now I should just be pulling fluid. Just take your time on this part, and you won't have to worry about bubbles so much. You can practice if we have time, and you can kind of check into that. I would just do like maybe 10 on these. Again, if you put too much in, you can't aspirate. And this is probably where it gets confusing. We say X amount for lidocaine, right? That's pretty much all injection. You can aspirate a little bit to make sure you're not in an artery, but with these, whenever we hook up to the sheath, if I have this with 10 in it, I really can't aspirate much, right? So that's where we end up just saying, to keep from confusion, just like 7 in all of them. So if you want to do that, that's fine, but I'm filling, right? So I'm going to flush. And one of these, even if I do it, I can kind of, I'm in my saline, which I would have labeled. So push, aspirate. That way I have enough room where I can aspirate, and when I go to flush, I have enough, technically I have enough to flush. Those sheaths don't hold that much fluid in that little lumen, but you can't do it with 2. If that makes sense. So again, whenever you poured my fluids, or I poured your fluids for you, I want to make sure I labeled this. I kind of forgot about that part, so I'm going to label, and I would have put 5K of heparin on it because that's my normal saline that's heparinized. So as you go, you want to label as you go. So whenever that fluid hits, that's when you want to go ahead and label it. You don't necessarily want to label it and then ask for the fluid. You kind of have to wait, and we do it at the same time. So I'm going to label this one as my waste, even though there's nothing in it yet. I'm going to go ahead and write. So remember, we have 2 sides. Let's see if I can do it right this time. We have skin and utility. One of them is more felty. One of them is more for obviously writing on other things. So we're going to use our utility side. And then I'm going to pick, I'm probably just going to use one of these blank ones, and I'll put waste. Waste, cap that thing. Waste, there's nothing in it yet, so I could wait, technically, but I would go ahead and do it so you don't forget. So that's my waste bowl, so I know that's my waste bowl. This is going to be my wire bowl. You might see different things. I would go ahead and say, label it, just because you don't know. We don't really waste stuff in it, but we are going to put some of our saline in here to keep our wires wet. So because that fluid's in there, even though it's not going to go inside the body, we're not going to aspirate or pull up anything, draw up anything, and put it in the body. We're still going to go ahead and label it. We're going overboard a little bit, right? So again, my utility side, I'm going to say, I'm going to put wire, just wire bold, whatever wire, and then I'm going to put 5K hep. Just because. That way I know for sure that there might be flush in here. It may be overkill, but we're going to do it. So then I can have my heparinized saline. I can take a few of my, I would say, just a few. Just grab some. We're going to pour some heparinized saline in there. That's going to be our wet ones that we wipe everything down with. We're going to wipe our sheath down. We're going to wipe our catheters down, our wires, so on and so forth. So we can take these, and in real life we can take them and we'll fold them up. That way, whenever you grab them, they're just easier to use. You don't have to do that. It's easier. It'd be kind of sloppy if you leave them open like this. So I've got my saline. See, I lost one, so I need another saline because I'm going to go ahead and have 2 flushes. So I'm going to go ahead and put 5K heparin on this one because it's not labeled. And so this one, I didn't write it. I was just telling you, but I'm going to go ahead and write it. So 5K. So now we know it's 5,000 heparin. 5,000 heparin is in these, technically, are slip tip syringes. So that's kind of ready to go. If I'm not going to use this one, I'm going to get it out of my way. Our needle to draw up, so I probably skipped that part because I'm used to us pre-doing it. I apologize. Our 18 gauge needle that we're going to use to draw up our heparin, because what we're going to do is we're going to pour your saline, and then you're going to do the 5,000 heparin. I don't know how many places do it like that. After 18 years or whatever, I apologize. We usually take the bags and pre-inject the heparin, and you kind of shake it up, and then it's in the solution, and you pour it in. It's the same thing. So we labeled the actual bag, and we would label our bowl. But what we're going to do is we're going to put your saline in. You're going to draw. You're going to ask for the saline separately. Can I have some normal saline in this bowl? Then you're going to ask for your heparin. I'm going to come over, and you're going to ask for expiration date on your saline. You're going to ask for an expiration date on your heparin. You're going to use your 18 gauge needle, the short one. Should be 1.5, I think, something like that. 1.5 inches is all that is. So this 18 gauge, it's the same as this one size-wise, just shorter. And that's what we're going to use for our meds. So then I'm going to come over with my heparin, or your heparin. I'm going to come over here to you. I'm going to make sure that I'm not down here to mess with, I'm going to do it the way it's supposed to be done, which is where people can have to be able to see it, right? I don't want to have to do this as the scrub tech, so I'm going to hold it up for whoever I'm giving it to. I'm going to go ahead and probably label this one just in case. So I can do one or two things. The problem with some of this, the way we do it, is I'm going to draw, then I'm going to have to label it, then I'm going to have to put it in there, and it's already gone. But we know what was in here. So we're going to go ahead and say, maybe overkill, but we're going to do it. So we're going to go, again, we're going to say, we're just going to put heparin, really, because we're not in a solution yet. So we're just going to say this is going to be our heparin. So you're going to ask for your heparin, ask for the expiration date. We'll both look at it together or double check. I'm going to pull my needle off. I'm going to be able to see my bevel, even though the bevel's not up like we do when we stick. I'm going to look at my bevel so I can see it whenever I inject or push it up in there, right? So I'm going to go in. So what you really want to do, the easiest way to do it, is to put a little bit of air in it first. You put it in, you poke a hole in the little rubbery part where I'm holding it over here, right? Then if you push the air in, because it's fairly contained, that air is going to push that fluid back out. So you push it in, and then you just barely pull on it, and most of it just sucks right back in. It creates like a positive pressure in there. So it just kind of pulls in, so we're going to pull back. So I can't remember which ones we have. We had a thing with heparin. Some of them were 10,000. So it was like 10,000 for every cc. We'll make sure, maybe we need to practice that some more for drawing up. I'm going to ask you how much to draw up. We should have one that it's 1,000 per, right? So 1,000 units per cc. So when we do it, we're gonna probably just do the 5,000, right? So we're gonna put 5 cc's, because if you do the other one, you have to do like 1 cc. It's stupid for what we're doing. So we're gonna go 5K, so that would be 5,000 heparin. If we had 1,000 units per cc or per milliliter, we're gonna pull up to get 5,000. We're gonna pull up 5 cc's. This is where we would inject into our saline. We're not going to recap. We're just gonna, even if you need to come up with a new one of those for now, you can do that too. Get it out of your way. You don't want to put it flat on your table though, because it'll stick through this pretty easily. I just barely did that and it just went through the table, right? My drape. So if you want to throw another one up here, you can do that and have something like that. But it's labeled. I know what was in it. My sharp is separate. At this point, that's when I would actually label this. So you really, if you wanted to open up, you could write, if you know which ones you're going to need, you could just write them all down real quick, and that way you don't have to stop every time you do something, and you just grab your sticker and go. So you know you have 2 with heparin, and again, I didn't write on it, so I'm going to go ahead and fix that. And if you did this, that's fine. You realize what you did, it's fine. We're going to 5K, and the heparin's already on there. So I'm going to close this up. I know I need 1 for my bowl. and I need 2 heparins for my slip tip syringes. So you know you're going to have to write because there are only 2 heparins on here. So as soon as you open this stuff up, you can go ahead and say, start writing heparin on one, or however you want to do that. It doesn't really matter. Just what takes a little bit is to do this part. So I'm here. I've got my lidocaine that I should have labeled too. I'm not used to labeling stuff. I apologize again. So what do we have to do? So we're going to do 1% Lido, which I would have put on as soon as you did this. You can use the yellow one, or you can write on it. I would just write on it and use the yellow ones both for my syringes, but it doesn't matter. As long as it's labeled, somebody else can grab it and look at it, it's fine. Again, I probably am not doing great because I forgot to label this thing. I'm just telling you to label it, but I need to go ahead and do it. 1% we're going to say, and 1%. Okay? So let's see, let me get my stuff out of the way. I'm kind of straight. I'm fairly, I mean, it looks okay for the most part, right? I mean, it's not perfect, but it's how it is. There's just always going to be some trash. There's always going to be some stuff in your way. Now what? Does it, I mean,
Your
do we look
sheet.
okay? I'd say probably sheath. Now at the same, again, if you pull these bowls apart and you want your sheath, tell me. I don't care when you ask for it. In real life, you're going to get used to doing it that way, and you're going to ask for it as soon as you can. So you're going to ask for a sheath. Can I have a sheath? Sure. I'm going to walk over. I'm just going to have one ready to go. I'll be over here. I'm probably going to ask you how far away. If not, I'm going to probably ask you what size it is for sure. So our colors. So if I gave you a gray sheath and I opened it up, what size is that going to be? 5 French. 5 French is going to be gray. So I'm going to open that up to you. You can leave it sit there while you do all this other stuff. It doesn't matter as long as you ask for it at some point and you do what before I open it? Ask for an expiration date. Everything that you ask for, which you have to ask for you have to ask for slit tip syringes, you have to ask for a sheath, you have to ask for fluids. Saline, heparin, lidocaine. Every one of those things, ask for an expiration date or ask to check the expiration date together. So I'm here. So I have a sheath. You want to throw me a sheath? I'll go ahead and get something on here real quick. Right here, grab one of those three, or that one. And don't use that. That's stupid short. Use this or one of those red ones too.
Right here?
Yeah, use one of those. So there should be an expiration date on all of this kind of equipment. So again, this would be my saline. It would be labeled. I'm going to ask for a sheath at some point. You can ask for it as soon as you get everything open. It's just usually it's easier to make sure that your stuff's kind of straight first, right? So I'm going to say, can I have a sheath? Sure. What's the expiration date? I mean, it's obviously expired, and I may even tell you that. That way I know you actually read it. But still, so you can open my sheath for me. You're good.